Hi, everybody. Thank you for joining us at the NAACP. So, a health guide by the NAACP, made for the members and the community as a whole. This is also a continuation, so it should be it's a series of courses. This is the third series. So, the first one, if you watched them, or if you haven't, go ahead and go back and watch them. We're going over how one illness leads to another illness. So in the first presentation, we talked about diabetes. The second presentation was about coronary artery disease and how diabetes can lead into coronary artery disease. Now we're going to talk about acute coronary syndrome and myocardial infarction. In layman's terms, these two are really what we call a heart attack. So ACS, acute coronary syndrome, and myocardial infarction just mean heart attack. And then we're also gonna dive into congestive heart failure. What is it, how do you get it, things of that nature. Okay, so let's get into congestive heart failure. So what is congestive heart failure? To keep it simple, congestive heart failure just means that your heart, it sucks. It's not pumping. So the heart is a pump that pumps the blood around your body, to your brain and to your body, right? If you have congestive heart failure, that means that your heart is not pumping as good as it's supposed to. So because of that, if you have a pump that's not pumping good, you're gonna have backflow. And so it's the backflow that's the actual issue, because the pump isn't pumping good, right? So the fluid is gonna start getting backed up into the system behind the pump. And that's where the problem lies for this, okay? So how does ACS and or MI, so MI stands for myocardial infarction, ACS is acute coronary syndrome, and acute means sudden. It doesn't mean adorable, it means sudden. Coronary, we're talking about the vessels that go over the heart. So we're talking about these vessels right here. All right, syndrome. So how does ACS and or myocardial infarction lead to congestive heart failure? So what happens is, if you watch the CAD video, give me 1 second. Previously, you would have seen that CAD means that you have pockets of fat inside the vessels, right? Really, we care more about the vessels that feed the heart, so the coronary arteries. They're called coronary arteries. And so what happens is that fat, that pocket of fat inside these tiny vessels that go over the heart, they're very fragile. There's not a lot of space. So if you get a pocket of fat that just builds up over time, and I go over how that builds up and becomes a complete obstruction in the previous lecture. So go ahead and check CAD out if you're curious about that. But that pocket of fat you see right here, so this right here is a magnification of this vessel right here, okay? And what's happening is that so much fat accumulated and something else happened that it blocked blood from going down to a part of the heart. So now that part of the heart is starting to die, okay? So once that tissue is dead, it's pretty much dead, it's gone. But it's still attached to the heart. So that part of the heart isn't gonna pump as good as the rest of the heart. So if one part of the heart is slacking, then the whole heart is gonna slack as a whole, because it's all connected, it's all one, even though it's one section, all right? So the heart is made up of 4 chambers, but all the chambers are connected, they all work as one. So when you get a heart attack, that's what's going to lead into congestive heart failure down the road, because you already have significant damage, and then the natural aging process occurs. You just age naturally, organs don't work as well, and then if you happen to have had a heart attack, it's just gonna make that speed up. So now your heart is starting to fail sooner than it should. That's why it's called heart failure. And it's congestive heart failure because the congestion of the fluid that gets backed up into the body, okay? So how does congestive heart failure show on the body physically? So physically, the only way you can really see it is gonna be, it's called pedal edema. So you're gonna have these swollen ankles and or feet too. And you'll know it's congestive heart failure because if you push on it, your finger will be imprinted in there for a little bit. Usually there's a bounce back no matter what, even if it's a muscle or if it's fatty tissue, there's a bounce back. But when it's pulmonary edema, really is blood that's backing up in the body. It's like a sac, so it just kind of balloons in slow motion, if that makes any sense. Also in your lungs, so you won't see this in your patients unless they're coughing up, but if the congestive heart failure is bad enough, they will start to spit up like a frothy pink sputum. And it's really just like mucus and blood mixed up because now the blood is getting backed up into the lungs, and that's what's going on with this patient. Besides that, just some home remedies for this patient. Something you can do as far as helping grandma or grandpa or whoever may have congestive heart failure is, let's say it usually happens at nighttime because the fluid is starting to settle down, the body starts to slow down, so the blood has time to pool and settle. So it'll happen at nighttime usually if this does happen. If someone that has congestive heart failure has difficulty breathing, a hard time breathing, that they can't catch the breath, an easy fix is just to sit them up, because then all that blood, when grandpa's sitting down right now like this, the lungs go long ways like this, so up, right? So when grandpa's laying down, a lot of that blood is gonna cover most of the lungs. So if you sit him up, or her, if it's grandma, that blood is gonna come down to the bottom portions of the lungs where there's less alveoli, and that's where gas exchange occurs, all that stuff. But we're not gonna get deep into that right now. This is just an introduction of health. So because of that, it allows grandpa to breathe, because literally he's pretty much suffocating on his own blood right now, or at least starting to, not to get too crazy. All right, so genetic factors. So sometimes they say it's genetics that is 100% true. From my understanding, fact check me for educational purposes only, genetics is as far as how to get congestive heart failure, but you never had a bad heart, you never had a heart attack, right? Is if you're someone in your previous family, so if your grandfather had it, if your father had a heart attack. So for example, if your father had a heart attack and now they have those dead tissues, and then they conceive you after the heart attack, your dad is passing on, or your mother is passing on those bad genes with the defected heart, and that's how bad genes get passed on. How you are physically when you conceive a child has a big impact on how your child's going to do down the road, physically and mentally. So that's really genetic factors. If somebody in your family had it and they just passed it on because they conceived the baby after they had a heart attack. And that is it for now. On behalf of me and the NAACP, thank you. Cool.